For Americans over 60 who have eaten breakfast cereal their entire lives, this story is personal. It's the story of a chemical preservative that has been sitting inside America's most popular breakfast cereals for over 70 years. Its name is butylated hydroxyanisole, known on ingredient labels by three letters, BHA. 30 countries have already pulled it from their shelves or placed it under strict restriction, and the European Union has formally classified it as a possible human carcinogen. Japan banned it outright many years ago, and the United Kingdom forbids its use in any food intended for infants. Until February of this year, the United States Food and Drug Administration considered the matter closed. That position changed in 2026 when FDA Commissioner Marty Makary announced the agency's formal post-market safety reassessment of BHA, marking the first serious federal review of this preservative in decades. The cereal box currently sitting on your kitchen counter, the one carrying the heart-healthy claim on the front, may still list this preservative on the back. For adults over 60, who have been eating these products since they were invented, the question is no longer hypothetical, it is overdue. Section 2. What BHA and BHT actually are. BHA stands for butylated hydroxyanisole, and its chemical cousin BHT stands for butylated hydroxytoluene. Along with TBHQ, these compounds form a family of synthetic antioxidants that were developed in the 1940s, patented for industrial use, and approved by the FDA as food additives in 1954. 5 years after that approval, the agency placed both substances on its generally recognized as safe list, where they have remained without serious challenge ever since. These compounds were never designed to nourish anyone because their job is purely mechanical. They prevent the fats and oils inside packaged foods from going rancid, which stretches shelf life from a few weeks into many months, and sometimes even into years. You will discover these preservatives in places you would never expect. They appear in breakfast cereals marketed for whole grain heart health, in instant oatmeal flavor packets, in granola bars sold to active seniors, in dehydrated potato products, in chewing gum, in butter spreads, in processed meats, in commercial cake mixes, and even in the wax coatings inside cereal box liners, where they can leach directly into the food itself. On a label, the letters will appear in small type, almost always near the very end of the ingredient list, frequently followed by the phrase "added to preserve freshness." The major American brands that have used one or both of these preservatives include products from Kellogg's, General Mills, Post, Quaker, Nabisco, and Pillsbury. Some of these companies have quietly reformulated their American recipes in recent years, while many others have not. Section 3. The 30-country wall. The European Union, with its 27 member states, has banned BHA as a food additive and officially classified it as a possible human carcinogen. Across that same union, BHT is heavily restricted and now requires specific authorization for any use in food. The United Kingdom, no longer a member of the EU but still operating under similar food safety principles, forbids both preservatives in any food intended for infants and limits their use elsewhere. Japan banned BHA entirely many years ago. Norway, Iceland, and Switzerland, all outside the European framework, apply their own independent restrictions. Australia, New Zealand, and Canada place tight controls on the levels permitted in any food product. Counted together, the wall of jurisdictions that have rejected or restricted BHA crosses 30 countries. The reason for this transatlantic divide is not a disagreement over chemistry, it is a disagreement over philosophy. European food regulators operate under what is known as the precautionary principle. When reasonable scientific doubt exists about a substance, the substance is restricted until that doubt has been resolved. The American approach is the exact inverse. Under the generally recognized as safe framework, an additive remains permitted until it is proven harmful beyond reasonable scientific dispute. The same studies, the same animal data, and the same human exposure estimates are read by regulators on 2 continents and produce 2 completely opposite conclusions. The same Kellogg's cereal sold in Manchester carries a different recipe than the one sold in Memphis. The American box still contains the preservative, while the British box does not. These companies know exactly how to make both versions. They simply choose which version to ship where. Section 4. What the science actually says. The case against BHA rests on several converging lines of scientific evidence. The United States National Toxicology Program currently lists BHA as reasonably anticipated to be a human carcinogen. The International Agency for Research on Cancer places BHA in Group 2B, which is defined as possibly carcinogenic to humans. The animal data behind these classifications is remarkably consistent. In rats and hamsters fed BHA at sustained dietary levels, tumors developed in the forestomach, a rodent organ humans do not possess, which is why the scientific debate continues over direct human relevance. Under the Delaney Clause of the Federal Food, Drug, and Cosmetic Act, the FDA must revoke approval for any additive found to cause cancer in humans or animals. Yet BHA remains approved despite these findings. Beyond cancer, both BHA and BHT have been identified by researchers as endocrine disruptors, meaning they can interfere with the normal signaling of hormones, particularly thyroid hormones, which govern metabolism, energy regulation, and tissue repair throughout the entire body. Honesty requires a second observation. The evidence against BHT, the lesser-known cousin, is weaker than the evidence against BHA. A long-running national toxicology program bioassay, conducted under carefully controlled conditions in rats and mice, concluded that BHT was not carcinogenic under the specific parameters of that particular study. Some food scientists continue to argue that at the low levels permitted in American food, both preservatives are unlikely to cause measurable harm. This is the position the FDA has held for 70 years. It is also the position that 30 countries have firmly rejected. The deeper concern for older adults is not any single research study, it is the arithmetic of an entire lifetime of exposure. A person born in 1955 has been eating these preservatives since infancy. They were present in the cereal of childhood, in the snacks of working life, and in the convenience foods of middle age. Aging slowly reduces the function of the liver and the kidneys, which are the two organs responsible for clearing such compounds from the body through hepatic metabolism and cytochrome P450 enzyme pathways. Many seniors are also taking multiple prescription medications, each of which competes for the same metabolic pathways. Exposure that a young liver can dispatch quickly will take significantly longer to clear at 70. The cumulative dose matters far more than any single bowl. Section 5, the February 2026 FDA reassessment. In February of 2026, the United States Food and Drug Administration finally announced what should have arrived decades earlier. A request for information was issued at that time, inviting scientific data on the current use and safety of BHA in food products and in food contact materials. The reassessment document is explicit about the reason for action. The National Toxicology Program has classified the substance as reasonably anticipated to be a human carcinogen, and the FDA now considers that classification adequate grounds for a fresh evaluation. This follows the agency's January 2024 ban of red dye number 3. Once the BHA review is complete, the agency has publicly stated that it expects to begin a parallel reassessment of BHT and of azodicarbonamide. The announcement carries significant weight precisely because of what preceded it. For 70 years, the FDA defended the generally recognized as safe status. That position has now visibly shifted. A reassessment is not a ban. A reassessment is the agency admitting that the original safety conclusion may have been wrong. For older Americans, the reassessment matters in one very specific way. The FDA's review will take considerable time to complete. During all of those years, the products remain on shelves. The cereal will still ship. The granola bars will still appear in the senior center vending machine. The reassessment alone does not protect anyone shopping today in May of 2026. It only signals that the protection promised 70 years ago is now under official federal doubt. The decision about what to put in the grocery cart this week falls to the person pushing the cart. Section 6. What seniors can do today. The first step is the simplest. Turn the box over and read it. The ingredients list runs in order of weight, from the largest component down to the smallest, which is exactly why BHA and BHT almost always appear near the bottom. The letters will usually be followed by the parenthetical phrase added to preserve freshness, or sometimes the phrase added to preserve freshness of packaging. Many American manufacturers have already quietly moved away from these compounds. General Mills removed BHT from a number of its cereals in 2015. Kellogg's reformulated certain products to use mixed tocopherols, a vitamin E-based preservative, in place of BHT. The reformulation has been uneven, brand by brand and product by product, which is exactly why the label remains the only reliable guide. For a generation raised to fully trust the federal stamp of approval on every box of cornflakes, the harder lesson is one of vigilance. 70 years of generally recognized as safe has not translated into 70 years of genuine certainty. 30 countries reached a very different conclusion long ago. The FDA has now finally agreed to look again. Until that review is complete, the safest choice is also the oldest one. Eat foods that do not require a preservative to survive the supply chain. Oats from a bin, fruit that ripens on a counter. Bread from a bakery that closes on Sunday. The pantry that needs no chemistry is the pantry that needs no warning label.